Kenya's recent heavy rains claimed dozens of lives. They also created a breeding ground for another killer. Rift Valley fever is a mosquito-borne virus that infects both animals and humans. Victims usually catch it from an infected animal. It kills 50% of the people who catch it, and the UN has listed Rift Valley fever among the viruses most likely to trigger a global pandemic.
The symptoms in humans are, there is fever, and hemorrhage basically is what leads to death in humans, whereby you bleed from the mucosal, every mucosal, regions of your body. The lining of the alimentary canal has mucosa there, and people even bleed and they pass the blood through, through the anus, or even vomit blood, and in such cases most of the time it results to death.
Kenya's first known fatality from this outbreak was an 18-year-old in the country's north. He had a fever for a week and then started bleeding. As of Wednesday, there are 15 other confirmed cases. The government has banned the sale and consumption of meat and milk in the affected regions, but experts fear that's not enough.
When Rift Valley fever, by the time it is realized in humans, it has spread widely in animals. They need to actually ban livestock markets for now, especially in the counties that are prone to these outbreaks. They need to restrict movement of animals because that is one way that it really spreads. They also need to involve religious leaders to encourage the populations, the local populations, to eat meat because, when it's coming from the government, it's the government, but when it's coming from the religious leaders again, it might have a higher impact, especially now that we are about to celebrate Eid.
The last major outbreak was in 2006, when more than 200 people were killed in Kenya, Tanzania and Somalia. The government is now seeking a vaccine and has set up isolation centers. It's also trying to warn people through community sensitization programs. Vauldi, Carelse, CGTN, Nairobi, Kenya.